I'm Lori Jemison, Nurse Clinical Coordinator at Froedtert Hospital in Milwaukee, Wisconsin. I've been working with the blood cancer group of patients probably about 15 years. I like being a clinical coordinating nurse. The role is so varied and you kind of end up doing whatever a patient may need, giving them resources, discussing potential meds that they may be on, and giving them some insight to the potential path that their disease could have. MPN patients struggle with the complexity of their disease, and because it is so rare, there's really a lack of a lot of good education that is easy for them to access. They feel that they are in a box by themselves.
She's one of the keystones of what we think about here, which is treating the entire patient, including their family. And Lori's been incredibly helpful in not only helping to educate the patients about what's happening, but also the caregivers and what they can expect.
When a patient needs something or asks me to do something, I won't stop until I can make that happen for them. I really try to encourage them to hook into things like support groups and or other patients that have been walking down that same path and not feel so alone. There are not a lot of myeloproliferative support groups in the nation and around this area. Several years ago, I was asked by a nurse that was working with the MPN Support Group if I would be interested in helping her out with that. So I went to the meeting and I thought, well, I think we could do this better. And by talking to the patients a lot about things that they would find beneficial, we've made a lot of changes to that group now. And I think I have a really good bond with the group of MPN patients that we have and really like doing this.
Groups like she organizes helps people feel less lonely, which is really an important part of reaching out and getting care.
There is a support group that is going to be happening today. I will be going over the introductions of who our speaker is, catch patients up on what's been going on or what new things they need to know. This one is going to be an entirely let's get caught up on everybody. People that are getting ready to potentially be going in the hospital for bone marrow transplants in a few weeks. And every step of the way, I'm always asking the patients for their input because this is their group. I'm just here to help guide them, help make everything easier for them.
I just saw my eye doctor.
I have always enjoyed mentoring and working with nurses that are newer to oncology. I'm a member of the Southeast Wisconsin Oncology Nursing Society. I help encourage nurses coming into oncology to get their certifications so that they become more expert in the fields. If they want to email me, and then I can help get them resources. Hopefully, I'm making a difference and making it easier for somebody to be the best oncology nurse they can be.
Coming to these groups have given me a lot of strength, and you're the reason that I'm so relaxed about going into transplant.
I had no idea there was a support group for MPNs, but I was very grateful for that information, and joining here has been very helpful.
Thank you. I can't believe the time that you give to us.
I get such joy out of helping these people. They become like my family now, so it is really important to try to help them through really tough times. If they're going in the hospital, I'm there to help. If they need something, I will go out of my way to get it. I feel if there's anything I can do just to brighten their day a little bit, that's what I want to do.